Ladies and gentlemen, welcome to Medsynapse Podcast. Today we have a special guest joining us, Dr. Ghazal Ilami. With over 7 years of experience in aesthetic medicine, she's all about using advanced methods to help people look the way they want. Her dedication has made her really popular in the field of aesthetic medicine. Dr. Ilami is here to delve into the world of regenerative medicine and aesthetics. We will be exploring the interesting realms of platelet-rich plasma and stem cell therapies. In today's episode, we will be exploring 3 interesting segments. The first segment will be on PRP and stem cells and aesthetics, where we will learn about the use and benefits of PRP and stem cell therapies. The second segment will be on effectiveness and outcomes, where we will discover the effectiveness and outcomes of these treatments. And the third segment will be on customization and patient communication, where we will explore the importance of customization and effective communication in achieving aesthetic treatment goals. Welcome, Dr. Ghazal.
Welcome. Hello, Dr. Nida. How are you?
I'm fine. Thank you so much. How are you?
So much. My pleasure having you.
Thank you so much for joining us. Let's begin the podcast. To begin with, Dr. Ghazal, can you provide an explanation of platelet-rich plasma, or PRP in short, and stem cells, highlighting their differences?
First of all, platelet-rich plasma, or PRP, is made of your own platelets. When you extract the blood and concentrate the growth factor and platelets, 5 to 9 times of the platelet concentrate in that normal blood concentration. It provides with the high concentration of growth factors and cytokines to accelerate wound healing. And stem cells derived from your own adipose tissue. When you're using a liposuction, you're using some procedure to drive the adipose tissues, stem cells, and make them grow in laboratory, differentiating the cell that we want. It's really helpful for regeneration of the new cells in anti-aging and reversing aging process.
What types of beauty issues can PRP and stem cells help with?
Almost every age-related problems can be addressed by PRP or stem cells. Fine wrinkles, age-related dark spots, and also volume loss, skin sagginess, hair loss, and fat cell atrophy.
Ensuring safety and effectiveness is critical. How do you make sure that PRP and stem cell treatments are safe and effective for beauty treatments?
First of all, it should be done under supervision of an educated and highly educated and trained professional. And the other thing is about the material. It should be done in a hygienic way and with FDA or any Ministry of Health approved kits and materials. It's really important to take a very good and precise history from patients.
Effectiveness is a big factor for our audience of doctors. Can you share more about how effective are PRP and stem cell for beauty enhancements and what factors influence their effectiveness?
First of all, both of them are clinically approved to be effective, but the mechanism of their action is completely different. Platelets just increase the speed of wound healing and skin and cell turnover and regeneration. But by stem cell, we are inducing your own undifferentiated cell to rebuild a new tissue. So, of course, when we are having mild to moderate signs of aging, like hair loss, slowing down of wound healing in some patients like diabetic wounds, we will provide the procedure with PRP. But when we are needing more regeneration and more acceleration, it's better to go for the stem cell therapy. Their effectiveness can be shown within 2 to 6 months, and it will last up to 2 years, especially for stem cell treatment, which lasts longer.
Now, when it comes to beauty treatments using PRP and stem cells, it is important to look at possible dangers and negative effects if there are any. So, are there any potential risks or side effects linked to PRP and stem cell treatments in beauty procedures? And if yes, how do you handle these risks?
Thank you so much. It's a very good question. First of all, because as long as they are autologous, homogeneous, there is the minimal risk of allergic reaction and any problem. Minimal side effect like pain, bruising, and swelling can be settled within a few hours, few days. And as long as it's their own patient's blood and their own cell, it will show less reaction. The most important thing, as again, I'm considering if you should take medical history if the patient has any history of using immune suppressive system, blood thinning product, if she has any allergic reaction, autoimmune disease, so it can be increased risk of procedures.
Personalization is key, especially in beauty procedures. What factors do practitioners consider when customizing PRP and stem cell treatments to fit the specific beauty needs of each patient?
Their expectation, what the patient expects from their own beauty treatments, their age-related problems, who should address their own problems according to their age, to their problem, what they need, and looking specifically how much they want to spend on the treatment, how can they be cooperative with us. That's the most important things.
How do you inform your patients about the benefits and possible limitations of PRP and stem cell treatments in order to help them make well-informed decisions about their beauty treatment options?
I will discuss with them about their lowering down their expectation. Of course, they are stem cell treatment and they are new, so there need more clinical trial to do the treatment for them, and we need to follow for more years for searching for the efficacy of the treatment. So, and I will also tell them that they should follow a very good skincare routine and follow other treatment in combination, but they're not the final result. In some cases, stem cell treatment or PRP is not the final, but maybe they should go under surgery.
Dr. Ghazal, we greatly appreciate your valuable insights into the world of regenerative medicine and aesthetics, focusing on our topic on PRP and stem cell therapies. Thank you so much for sharing your expertise and knowledge with us today.
Thank you so much for your time. It's a pleasure if you're having me here.
Thank you so much, and looking forward to more podcasts together. And also, our heartfelt gratitude goes to our listeners for tuning in. This podcast is proudly presented by Medsynapse, a platform facilitating global connections, collaborations, and learning among medical professionals. Join us on Medsynapse to interact with esteemed experts like Dr. Ghazal, and don't forget to subscribe, like, and register on our website to stay updated with interesting topics. Until we meet again, stay well and goodbye.